All right. Thanks so much for doing this podcast with me. I appreciate it. First off, tell the audience a little bit about yourself and how you started in the work that you do today.
Sure. My name is Dr. Stacey Gagliano. I am a psychologist, a licensed psychologist in the state of Pennsylvania. Um, and how I started doing the work that I do today is kind of a non-traditional path, I guess you'll call it. Um, After college, I got what's called an EDS degree. So it's an educational specialist degree. Um, as a school psychologist in New Jersey. And then I worked in the public schools for several years before I decided to go back to school to get my doctorate. And then I got my PhD in school psychology at the University of Northern Colorado. Um, and I worked in a number of different settings over the years during my training and whatnot, including hospital settings and residential treatment centers. And eventually that led me to my current position where I work at a private practice called the Center for Neuropsychology and Counseling in Chalfont, Pennsylvania. And I do individual therapy and I also do psychological evaluations with kids, teens, and adults. So, yeah.
hmm Tell me a little bit about the what you do in individual therapy, just to get a sense of what it's like.
Sure. I should say I do family therapy as well. That's another component of what I do. Um, so I work with all ages, but I specialize in kids and teens. So I see a lot of children and teenagers, and what I do really depends on the age of my client and why they're here. I treat a number of different diagnoses or presenting problems, and so it really depends on what the client is coming in with, what their concerns are. With younger kids, a session might involve playing a bunch of games of Uno and Jenga, and sometimes we play The Floor is Emotion Lava. And I teach a lot of skills. With teenagers, it might be more process oriented and talk therapy, but again, I'm very skill oriented, so I try to teach a lot of coping skills to help my clients manage whatever the symptoms are that they're experiencing.
hmm I was gonna ask, like, what sorts of modalities do you use in your practice?
Sure. So I have a pretty integrated approach. I was trained in a number of different modalities, including DBT, CBT, ACT, uh, person-centered therapy, or client-centered, depending on your terminology. So I really kind of I know this is like a not the most straight answer, but I really kind of adapt to whatever is working for my client because I do find that people, um, it following a script doesn't always work for me, depending on what my client is coming in with, because I see people who are coming in for so many different reasons that I try to pick um, the components of each treatment that are going to work best for them and see what resonates with them.
hmm so like, um, you also said that you do psychological evaluations. What does that entail?
It's a good question. So a psychological evaluation again looks very different depending on what the person is coming in with, but or what their questions are. But usually it involves a consult. So first I meet with either the parents, depending on the age of the client, or the client themselves. We talk about again what their concerns are. Um, and then we I usually then I meet with the client if it's a child or a teenager. So I talk to the parents first, then I talk to the client for an hour, and then we determine how many hours of testing we would need to answer whatever their questions are that they were coming in with. And it's usually between 3 and 6 hours of testing broken into 2 different days. And that's like where I sit one on one with the person and ask them a bunch of questions or have them do different activities. At the end, I look at all the data and it tells me things about how their brain works. It tells me about their strengths and as well as the areas that are more difficult for them. And sometimes a pattern emerges where a diagnosis might be clear, um, and sometimes it doesn't, right? Sometimes it gives me a clear pattern of strengths and weaknesses, but they don't meet criteria for a diagnosis. Um, but generally speaking, right, like especially with kids and teens, what that usually means is that when we get to the end, those things will then translate into them being able to get access to accommodations at school. Or maybe for an adult, it might be accommodations at work, or help them guide them in terms of treatment options for whatever it is that they've been struggling with.
Mm-hmm. Like I was gonna, I forgot to ask this, but what sorts of, I guess what have you learned in doing this kind of work? I always ask guests this when they're on my show. What have you learned in doing this kind of work? Just the kind in your sort of practice and working with your clients,
What have I learned, kind of generally speaking?
generally speaking, yeah.
Um, that's a tough question. Um, I, I mean, I feel like my clients teach me new things every day. Um, I've always been, I think, pretty adaptable as a person and flexible, but if there's something that I've found that I learned that I certainly need in this job, it is adaptability and flexibility because I never know what someone is going to come in with or what is going to be on their mind or what's going to come out during an evaluation. And so I have learned, I guess, not to be surprised and um, to follow my client's lead, be adaptable, and be open.
Mm-hmm. And if you have to like learn something new within like your practice, is there like something that makes you go, I wonder what it's like working with, th this population. Is there anything that you want to check off your bucket list that you want to go, maybe I want to dive into this a little bit more?
All the time, I have to say that happens all the time. I mean, I will say, for example, I don't specialize in OCD treatment. I've diagnosed OCD through the evaluation side of my job, the assessment side of my job so many times, but I don't specialize in treating OCD because the treatment for OCD is very specific. Um, and, it requires specific training, right? And we do actually thankfully at my office, at the private practice that I work at, we have a great team, and one of our other clinicians here is an expert in OCD, and so I pick her brain all the time. But I remember just last year I was getting a wave of more and more teenagers with flavors of OCD, like that they had certain symptoms, although they might not have met full criteria for OCD. Um, and then, that sparked me to like find more information on it. I did a bunch of trainings. Like I said, picked my coworker's brain. I read 3 different books on OCD. And I find myself doing that all the time, depending on what people are coming in with, you know what the presenting problems are. It really I feel like the amount that you can learn is never ending.
Mm-hmm. Yeah. Like, I know, there's another question that's on my mind that I have to ask you. Like, was there some sort of a mentor that you sort of looked up to, or like a class that you did when you were in school that you thought, maybe I want to be a psychologist, or maybe I want to be like this person one day?
Yeah, I actually also a very good question. No one has ever asked me that before. So uh I actually found high school to be, you know, difficult at times. I always had a hard time in high school with the subjects that just weren't as interesting to me. Or that I felt like were harder for me. Um, some subjects I found that they came so easily and I really excelled at them, and then other subjects they were so difficult that or they felt difficult in a way that made me kind of to avoid them, I guess, right? As I think we all do to some extent, right?
Yeah.
And um, and I took an AP psychology class. It was just an elective, but I took an AP psychology class in my senior year. It just sounded interesting and it made perfect sense to me. Like every day I was like, yeah, okay, I get that. Um, and I actually went into my undergraduate career majoring in sociology. Um, because similarly, I had taken an elective in sociology and I found it very interesting and it made sense to me. And then before you know it, my academic advisor during my undergraduate career said to me, you're only two classes away from a double major in psychology. And I was like, I am. So, so I kind of actually happened upon psychology by accident and had never intended to become a licensed psychologist or get a doctorate. But then when I was working in this, I've always loved working with kids. And I value education very much, and so that's what led me to my school psychology career. And then when I was working in the schools, I had a coworker. My coworker, Dr. Moratuit, she was amazing, and she really pushed me. Um, to learn more, to excel, and she was very supportive of the idea of me getting a doctorate. Um, it's funny because I haven't thought about her, like I haven't thought about that experience in a while. No one has asked me that question, but yeah, she's probably a big reason why I decided to go get the doctorate. I thought she was amazing. She
Mm-hmm.
still is.
Yeah. The reason why I ask that is because, like for those who want to enter the psychology field, and this is kind of a wrap-up question. For those who want to enter the psychology field, what tips, advice would you give to those coming into it to for them to be prepared to like embark on the psychology field? Because given your experience, what advice would you give students or people wanting to think about, maybe I want to go into the psychology field, explore what that's like.
um, I think I would recommend doing um some work or internship experience in the field first, um, like whether that be behavior tech at a hospital or a treatment center, working with a certain population of individuals, maybe shadowing, in a school or in a clinical setting, just to get your feet wet a bit and make sure that it's something that you're really interested in. I absolutely love my job, and I'm very proud to say that I wake up every day excited to go to work. And also, becoming a psychologist is a big commitment. It's a lot. It's a long time in school, and it's really hard work. And so, um, I think for a lot of the students that I've supervised too, I think it can be disheartening along the way, you know, where people might question whether or not it's the right choice for them. So knowing that it's the right choice for you, or knowing that you really want to work in this kind of therapeutic environment in a helping profession, that this is work that you value and enjoy ahead of time, I think um, would make the experience more seamless. Yeah.
All right. Okie dokie.